Hello, everyone. My name is Kayla, and I am a clinical psychology PsyD student at the California School of Professional Psychology at Alliant International University, San Diego. Today, I will be discussing the dialectical behavioral therapy, or DBT, distress tolerance skill and crisis survival skill TIP. So TIP is an acronym that stands for tipping the temperature with cold water, intense exercise, deep paced breathing, and paired muscle relaxation. Note that there are two P skills, even though there is only one P in TIP. These four skills are used in crisis situations to change your biological response in order to reduce intense and heightened emotions. So why exactly would we use TIP? These skills aim to decrease intense emotions and overwhelming feelings by changing the body's chemistry. When someone is overwhelmed with intense emotions, they need relief as soon as possible. TIP skills are quick and efficient, and they begin working within seconds to minutes. Clients often turn to dysfunctional behaviors in times of distress that help regulate their emotions in the past, such as self-harm, drinking, using substances, or engaging in eating disorder behaviors. The effects of the TIP skills on distressing emotions can be equally as effective as the dysfunctional behaviors. Another benefit of the TIP skills are that some can be used in any setting without drawing the attention of others. These skills do not require much thought, which means that clients can use them even when their emotions are affecting their thought process. Now that we know why we use TIP skills, let's look at what situations we would use them in. TIP skills are extremely helpful when an individual is in emotion mind, meaning that their feelings are guiding their thoughts and behaviors. These skills are useful in crisis situations when one's urge to engage in destructive behaviors is high. Distraction skills can be useful, but however, some clients may reach a point that distraction from their emotions is not enough. These skills can be used when clients are feeling too overwhelmed by thoughts or emotions, when they cannot use other skills, when other skills are not working, and when thoughts or feelings become so intense that it affects the ability to think. You might be wondering how exactly these skills work and what causes them to be so effective. TIP skills activate our body's physiological nervous system in order to decrease emotional arousal, meaning these skills target the physical symptoms of intense emotions in order to help bring down the intensity of emotions overall. There are two parts to the nervous system. The first one is the sympathetic nervous system, which activates the fight or flight response and increases emotional arousal. In contrast, the parasympathetic nervous system regulates emotions and decreases emotional arousal. TIP skills regulate emotions by decreasing the activity of the parasympathetic nervous system and increasing the activity of the parasympathetic nervous system. And my bad, I meant at first, they regulate emotions by decreasing the activity of the sympathetic and increasing the activity of this parasympathetic. Sorry, words are hard right now. By changing one part of the emotion system, you change all of the system. Now we're going to talk about the skills. The first skill is tipping the temperature, which is done by putting cold water on your face and holding your breath. This activates the dive reflex, which leads to a reduction in emotional arousal. You may be wondering, what is the dive reflex? The dive reflex, also known as the mammalian dive reflex, is the tendency in animals for their heart rate to slow down when immersed in cold water without oxygen. This reduces both heart rate and blood flow. The decrease in heart rate and blood flow is due to the increased activation of the parasympathetic nervous system, which decreased emotional arousal. When the sympathetic nervous system is overactive and the parasympathetic nervous system is underactive, we enter a state of emotional overarousal. Now that we understand the science behind tipping the temperature, let's look at how to use the skill. To enact the dive reflex, bend over and hold your breath in a bowl of cold water for 30 to 60 seconds or until you feel discomfort. Make sure your face is in the water at least up to your temples so the dive reflex occurs. Another option is to use an ice pack or another form of cold compress. To use this method, sit down and hold the ice pack over your eyes and cheeks while making sure the part covering your eyes is wet. You can also splash cold water on your face, but make sure the cold water you splash is on your eyes and cheeks. To make this more effective, bend forward, stand, and hold your breath. You might not always have access to an ice pack or bowl of water, so splashing water is a good option that you could do anywhere there is a sink. Once emotional arousal is lessened, use other skills to help with the problem. For example, if you become triggered by the anger you feel due to arguing with a partner and you go to the bathroom to splash water on your face to help reduce your anger before the argument escalates further, you would reduce your anger in the moment, but those feelings of anger would likely return when you re-enter the room where your partner is. You would want to pair it with another skill in order to fully cope with the emotion effectively. Tipping the temperature skill is one a lot of my clients who struggle with self-harm found helpful. One function of self-harm is to provide relief from intense emotions. And tipping the temperature is an equally effective alternative. It is also important to note that this skill should not be used without permission from a medical provider by individuals that have a heart disorder or any condition that causes low heart rate, including individuals with eating disorders such as anorexia or bulimia. The next letter in TIP is I, which stands for intense exercise. To use this skill, an individual engages in exercise for at least 20 minutes. Around 20 to 30 minutes of exercise has been shown to increase positive feelings as well as decrease negative emotion, negative mood, and rumination. The goal of intense exercise is to increase your heart rate to around 70% of maximum heart rate that's age appropriate. Instead of acting on emotions that trigger fight or flight response, you'll re-regulate your body and reduce the physical symptoms of your heightened emotional state. This is helpful for individuals experiencing anger, ruminating thoughts, and increasing positive mood. For example, you just had an important interview to a graduate program and you are fixated on the fact that you stumbled over your words. You may be ruminating over the thoughts of I'm a failure or I am so stupid, and you cannot shake them. Going for a 20-minute run can help decrease the intensity of these thoughts and allow you to think more clearly. It is also important to note that exercise may not be appropriate for clients struggling with an eating disorder or disordered behaviors due to the effect on heart rate, and these individuals often exercise as a compensatory behavior. Next, we have paced breathing. Paced breathing is slowing down your breath by reducing the pace of inhaling and exhaling and breathing from your abdomen. If possible, aim for 5 to 6 breath cycles per minute. A key to this being effective is making sure your exhales are longer than your inhales. So if you breathe for 6 seconds, you will exhale for 8 seconds. When you inhale, your heart rate increases and slows down when you exhale. Similar to the dive reflex, this is influenced by the activation of the sympathetic and parasympathetic nervous systems. Slowing down your breath about 5 to 6 breath cycles per minute activates the parasympathetic nervous system and reduces intense emotions. Paced breathing is a skill I find particularly useful for inpatient settings. The time we have with patients is often limited, so this skill can be taught quickly and the patient can use it wherever they are to help regulate their emotions. The final skill is paired muscle relaxation. This skill pairs relaxing your muscles while breathing out. If you are familiar with progressive muscle relaxation used for anxiety disorders, this is another variation of that technique. To use this skill, tense your muscle groups while simultaneously focusing on the tension while breathing in, and relax your muscles on the exhale to release the tension while you focus on the sensation. The primary goal of paired muscle relaxation is to increase awareness of tension and relaxation, which is similar to select mindfulness procedures. Paired muscle relaxation teaches participants to notice the tension and relax muscles while exhaling and saying the word relax. This skill is useful for when there is not much time to use other skills or when an individual is in crisis. To practice paired muscle relaxation, start by having participants rate the amount of distress they feel on a scale of 0 to 100, with 0 being as calm as could be and 100 being the highest amount of distress possible. Then, walk clients through tensing each part of the body for 5 to 10 seconds each. Once the exercise is complete, have the clients rate their distress again to see whether or not it has improved. Here is a list of all the body parts you can go through tensing and releasing. You would start with hands and wrists, then go to lower arms and upper arms, shoulders, forehead, eyes, nose and upper cheeks, lips and lower face, tongue and mouth, neck, chest, back, stomach, buttocks, upper legs and thighs, calves, and ankles. So to briefly review, TIP is useful when emotions are too intense to use other skills, and they aim to regulate the body in order to relieve the physical symptoms of emotional arousal. These skills are great for all settings, and they are highly effective. I hope you find these skills to be helpful and have learned new ways to reduce intense emotions. Here are some references.